Hi, I'm Dr. Amber Belt with Sage Serona and Aspen Integrative Medical Center, and today I want to talk to you a little bit more about blood pressure. Now, if you have pre-hypertension or if you have straight up high blood pressure, you've probably been advised to monitor your own blood pressure at home. If you haven't, it's a good idea to track your own blood pressure. There's a couple reasons for this. First of all, how are you going to know what's working and what's not in terms of medications or supplements or other interventions if you're not tracking your blood pressure at home? Second, tracking your blood pressure at home can help your provider make adjustments to your treatments based on those readings that you're taking when you're not in their office. So what I want to talk to you about today is getting the most accurate blood pressure readings when you're taking your blood pressure at home. Okay, keep in mind that I am a doctor, but I'm not your doctor necessarily. And so if you need medical advice, talk to your own practitioner. Also keep in mind that at the end of January, the end of this month, I am teaching an in-depth blood pressure class called Breaking Down Blood Pressure, where we're going to dive in deep and I'm going to teach you a bunch of stuff about blood pressure. When I send patients home to do at-home blood pressure measurements, I'll generally have them measured twice a day, once in the morning after they get up and once later in the day. And generally that turns out to be in the evening when they're kind of winding down and relaxing. So for an accurate reading, I have people do this. Be sitting quietly, that's pretty self-explanatory. No smoking or drinking caffeine 30 minutes before you take your blood pressure. I tell them to make sure they have the right cuff size. So cuff size is important because if you have the wrong cuff size, it can give you an inaccurate reading. So this is a cuff size for like the average adult arm, the average adult size arm. So this is the size I would use. However, some people need a large cuff, and you can see, flip this around, you can see that the large cuff is quite a bit bigger than the small cuff. If you need a large cuff and you're using a small cuff, you are probably going to get an artificially high reading. Okay, so we also have patients make sure that their arm is relaxed and supported. Okay, an arm that's hanging down too low is going to give an inaccurate reading. An arm that's tensed up is also going to give an inaccurate reading. So your arm needs to be relaxed and supported. Be still. In the office, we see this a lot. We see people who are getting their blood pressure taken and they're talking and they're gesturing, and that just messes their readings up. Sometimes we don't get a reading at all. Sometimes we get a super high reading. So we tell people to, again, be still and don't wiggle around. The last thing we tell people to do is stay calm. So I understand that getting your blood pressure taken can feel like you're taking a test that you almost know you're going to fail. So it can create some nerves and anxiety around even taking your blood pressure. So that's going to artificially elevate your readings too. So really try to stay calm when you're taking your blood pressure. And what we do for people who get nervous when they get their blood pressure taken, we'll have them measure their blood pressure the first time, and they take that reading, they can document it, but we'll have them take it a second time because oftentimes that second reading will come down into a more normal range and be a more accurate reading for that person. Another question you may be asking is, what's the most accurate instrument to use to measure blood pressure? Is it a wrist cuff? Is it a digital arm cuff? Is it taking blood pressure manually? I'm going to talk about that. So measuring manually is sort of the old-fashioned way of taking blood pressure, and we use a stethoscope and a sphygmomanometer. Manual blood pressure cuffs aren't generally recommended for at-home use because there's a pretty high rate of user error, and we want you to get as accurate a reading as possible. But manual blood pressure cuffs are consistently within 4 millimeters mercury of being accurate. So that's a very small margin of error. So taking your blood pressure manually is still your go-to in clinical settings. The way we do this at my clinic is we start with measuring it digitally. We have a cuff that's hooked up to a digital blood pressure monitor, And then if things seem off, we'll take that blood pressure manually. Or when someone's in for their annual physical with me, I will take their blood pressure manually as part of that annual physical. Digital measurements might be inaccurate up to 15 millimeters of mercury. That means if your top number is 130, it might bump you up to 135. So 15 millimeters of mercury is a decent margin of error. Some people consider digital cuffs not to be accurate enough for a clinical medical setting, but okay at home. Wrist cuffs specifically have been shown to read too high a lot of times. Again, up to 15 millimeters of mercury too high. So to get the best read from your wrist cuff, you need to know a couple things. Wrist cuffs are really sensitive to positioning. So you really need to make sure that arm is supported, ideally at the level of your heart. So maybe a little higher than I am now. Wrist cuffs are good options though for people who have bigger arms or who can't get their blood pressure taken with their upper arm using that. So wrist cuffs have their pluses and their minuses, so you just have to know a few tricks and tips to use them to get the best read. Now, the other thing you can do is you can take your digital cuff to your doctor's office, have them take your blood pressure manually, and then take your own blood pressure digitally with your at-home measuring device. My patients do this with some regularity, so we can know how close their instrument is to the manual reading. So at least we know what we're getting into with that. So it's good information to have. Okay, I hope that this video helps you track your blood pressure at home more accurately. Please feel free to share this information with anyone that you know that measures their own blood pressure at home. And please keep in mind that on January 29th, I'm going live and teaching breaking down blood pressure, and we're going to talk about blood pressure medications, their side effects, what vitamin and mineral deficiencies they can cause. We're going to talk about natural therapeutics. We're going to cover a lot of information in that class. So if you have high blood pressure, or you have prehypertension, or you love someone with blood pressure, this class is one you're going to want to get in on. You can either go to my bio on Instagram, or you can go to sageserona.com to sign up for the class.